Wonderful. Okay, well, thank you all for joining. I am so excited about this series, the 2026 Global Collaborative Series. The title is Global Nurse Force, and that's Bridging Health and Climate Action. And all of our sessions have just been so wonderful, and I'm especially delighted about today's session. This monthly event is made possible through the generous collaboration of our esteemed partner host. So, Dr. Jean-Marie Staccherini, who is professor and associate dean for global affairs and director of the PAHO Collaborating Center at the University of Michigan School of Nursing. And then we have Dr. Asia Napane, who is the Director of Global Affairs and Planetary Health at Yale School of Nursing. And then I am Dr. April Kapu. I'm the Senior Associate Dean for Partnerships and Global Affairs at Vanderbilt University School of Nursing. And I am joined by my colleague here, Betsy Usher, who is our Senior Director for Alumni Relations. Just thank you to this whole team for your dedication and your contributions to this initiative. Each month we take turns hosting this series, and we just encourage all of you to join us every month as they're so exciting. So now I would like to present our speakers for the day. So we have Dr. Karen Moore. She is a globally recognized leader in advanced practice nursing, serving as editor-in-chief of the Journal of Nurse Practitioners. She's secretary of the ICN NP APN Network Core Steering Group and coordinator of the Global and Planetary Health program at St. Louis University. She's a Fulbright specialist and alumni of the International Council of Nurses Global Nursing Leadership Institute, and she brings deep expertise at the intersection of clinical practice, global health, and policy. Her work spans global and planetary health, infectious and environmental health, and health equity. She advances nursing leadership to address the needs of underserved populations and drives meaningful change across diverse healthcare systems. Welcome, Dr. Moore. And we have Dr. Casey Bellegarde Armstrong. She's a public health nurse and national leader in planetary health. She is currently serving as regional manager of the place-based initiatives at Healthcare Without Harm. She was doctorally trained in health innovation and leadership from the University of Minnesota and Masters of Public Health from Johns Hopkins. Her work centers on how health sector can reimagine its role as a healer within communities and for the planet. Through climate advocacy, healthcare design, and community partnerships, she advances sustainable health systems and equity-focused approaches that promote the health of both people and the environment while strengthening global nursing leadership in climate action. Welcome to you both, and I'll turn the time over to you.
Thank you, April. We appreciate so much the opportunity to speak to our esteemed colleagues who have an interest in this area. And we look forward to making the case for why this should be important to all of us, not just a small select group who sees their view as global health and planetary climate action. Professional relationships we wanted to disclose are listed here. And we wanted to start with a quote by Sir David Attenborough, who spent a lifetime working on planetary issues, caring for our common home. And the quote that resonates with me the most is that the truth is the natural world is changing, and we're totally dependent on it. It provides our food, water, and air. It's the most precious thing we have, and we need to defend it. I think a lot of times as nurses and advanced practice nurses, we sit on the sidelines sometimes and we think, well, we're just going to impact health, and we don't really have the ability to impact this larger content. But hopefully, after you finish our presentation today, you'll see where the issues are important to all of us. There is something each of us can do, and you'll be mobilized to see the change and be the change in your community. I'm going to turn it over to my colleague, Dr. Casey Bellegarde Armstrong, and I look forward to her presentation. Casey?
Great.
Thanks, Karen. Hi, everyone. Thanks so much to our hosts at the Global Collaborative Series and to my colleague, Dr. Moore, for the invitation to be here today. As folks said, I'm Casey Belgard Armstrong. I'm a public health nurse and place-based initiatives regional manager at Healthcare Without Harm. So that means I support our local hospitals, clinics, community-based organizations, and allies to find community-driven solutions to shared climate and health challenges, and they sit around a collaborative table as equal partners. I'm also the Policy and Advocacy Forum co-chair with the Alliance of Nurses for Healthy Environments. Next slide, please. I always like to start off discussions about climate action with talking about what calls you to this work. Why are folks here? I invite you to share in the chat your why that brings you to climate action as a nurse or a health professional. I first got involved in climate action to keep other people's children safe. I was working as a public health nurse, visiting first-time low-income parents and their babies during the worst fire season in Colorado's history. And families had lots of questions for me about how to keep themselves and their babies safe. And I didn't feel like I had enough good answers for them. I wasn't trained and I didn't know. And so I started learning so I could do better to protect families. And now, as a mother myself, that healthier, more sustainable, more equitable world I'm trying to build with colleagues feels even more urgent and pressing as I raise my own daughter. So I invite folks, as you're introducing yourself in the chat, to also share what's bringing you here. What's your why? We can go to the next slide. Um, I share this tool in my presentations. If folks that are looking for more direction on your path in climate action, really how to find or harness your why. This tool is really a useful one. The climate action Venn diagram from marine biologist and climate policy expert Dr. Ayanna Elizabeth Johnson. She's written a really wonderful book on climate action called What If We Get It Right? But this tool prompts you to think about three questions. What are you good at? What brings you joy? And what work needs doing? And then you can find your climate action at the intersection of those three questions. And so I'm just sharing this at the outset. I invite you to consider this tool as we go through the presentation and talk about some examples of the work that needs doing. And identify for yourself one or two climate actions that you could take in your workplace or community after this session. Next slide. Um, as we were preparing for today's session, we learned that the Global Collaborative Series has already had many wonderful environmental nurse experts join this year already, including Dr. Katie Huffling from the Alliance of Nurses for Healthy Environments, who, of course, gave a fantastic overview of climate and environmental action opportunities for nurses. So I'm going to focus my remarks primarily on climate and health trends at the policy level and engagement opportunities for nurses there. And then Dr. Moore will take us home with discussing implications for practicing nurses and APRNs. But I'll just start us off with a really brief overview, kind of Planetary Health 101, just to situate us. And I see folks are starting to share their whys in the chat, so keep that coming. That's great. Next slide, please. So I ground my nursing practice within the planetary health framework, meaning human health is inextricably connected with the health of the planet, and human activities have been degrading and destabilizing the planet to the point where it's starting to show signs of severe illness. Climate change is just one abnormal vital sign of a planet in multi-system failure. Biodiversity loss, pollution, land degradation, ocean acidification are these other signs, other planetary boundaries that we're trespassing for safe and stable life on Earth. Next slide, please. And so some researchers and scientists have even gone so far as to nickname this age that we're living in as the Anthropocene, because we're so profoundly shaping the life and natural systems on this planet with our activities through consumption and waste and extraction and domination, profit over people. These underlying drivers are disrupting the systems that nourish our air and land and our weather, and that in turn shapes our health. Next slide. The World Economic Forum releases an annual global risks report that's based on a survey of over 1,300 global leaders and risk experts. And they distill the top global risks over the short term and the long term. They look at 2 years and the next 10 years. Environmental breakdown is consistently recognized as a top risk to global security, shaping the health, safety, and economic stability of communities around the world. So it's really essential knowledge for nurses and other health professionals to know how to treat the health impacts of our planetary emergency, not only through the care they provide at the clinical level, but also advocacy and interventions at the policy level. Next slide. I really like this visual from the California Department of Public Health summarizing the health impacts of climate change. It drives stronger and more frequent storms, temperature extremes, it disrupts our mental health, it degrades our food and water systems, increases vector-borne illness, it exacerbates racial and health equities. It really acts as a threat multiplier in that way. Next slide. Climate change also just shows up directly in our exam rooms, emergency departments, school nurse offices, with conditions like asthma exacerbations, heat-related illness, and tick bites. And the way that it disrupts our supply chain or damages healthcare infrastructure, making it difficult for nurses to kind of keep things running during disaster or surge events with the right supplies and resources that we need to care for our communities. Next slide. We also know definitively climate change and its health harms do not impact everyone equally. On the slide here, looking at groups on the left, are examples of populations made vulnerable to climate change by virtue of a biological sensitivity, such as pregnant folks, children, the elderly. And then there's also just the exposure to climate threats, like for unhoused individuals or outdoor workers who have that higher risk of or higher likelihood of exposure to temperature and weather extremes. Groups on the right are examples where climate change and injustice collide. Low-income communities, Black, Brown, and Indigenous communities are made more vulnerable to climate change due to structural racism and systemic disinvestment and how those factors collide. Next slide. This climate justice is amplified on the world stage, in which countries who contributed the least to climate change are impacted the most by climate threats. You can see on the visual to the right from World Resources Institute, the top 10 global emitters of greenhouse gases make up 2/3 of global emissions from China, the US, the EU, Russia, and so on. And yet the most climate vulnerable countries are those in sub-Saharan Africa, like Sudan, Chad, Central African Republic, small island nations like Tuvalu and Kiribati, as well as South Asian countries like Bangladesh and Pakistan. And so when we think about a global nurse force for climate change, these power dynamics and histories between countries and the need for systems of accountability for kind of who's contributed the most and who's impacted the most are really important to consider. Next slide, please. So how are we doing globally when it comes to addressing climate change? Next slide. In 2025, 10 years after the Paris Agreement, when countries around the world agreed to work together to limit global warming and begin to account for and mitigate their emissions, the folks at Systems Change Lab published a report to assess the state of global climate action. They looked at 45 indicators across decarbonizing energy, transport, industry, buildings, things like phasing out coal plants, halting deforestation, reducing food waste, and they found that no indicator is on track for 2030. So we have work to do, I would say. Next slide. And so for those of you that remember the struggles of group projects from school days, bringing the nations of the world together to work at the same table on a project as high stakes and large scale as healing the planet is not easy. And we've seen over time that our progress on climate action is shaped by complex factors like geopolitical relationships and corporate interests and consumer behaviors and ideology. In the US, especially, our progress on climate is very dependent on the presidential administration at any given time, and less so on the availability of possible solutions. We have many of the solutions that we need, but implementing them at scale has come with many challenges. And our addiction to fossil fuels can be so absolute that we will go to war over it. Next slide. So these are some key climate policy trends that it's important for nurses to be aware of so far this year. This slide has more of a global policy view, and then the next slide is US centric. And yet you'll still see the US here on the global trends because the first half of this year has seen some big moves from the US shaking up global climate policy, with the administration announcing the US's withdrawal from the landmark Paris Agreement that I just mentioned in January of this year, and then from the UNFCCC in February of this year. The United Nations Framework Convention on Climate Change, or the UNFCCC, is a UN body that organizes global coordinated action on climate change and oversees the negotiations process where countries come together annually to take stock of progress and negotiate new global climate policies. This is called COP. And as we saw in an earlier slide, the US is a top global emitter, and it has also been a seat of outsized influence and power and resources in the world. And so its abdication of responsibility on climate change has a big ripple effect globally. But some of these ripples have been positive in the form of more visible leadership from other countries who are determined to fight for a livable future for all of us, even while some sit on the sidelines. And so, for example, in April of this year, the first international conference on transitioning away from fossil fuels was hosted in Santa Marta, Colombia, led by Colombia and the Netherlands. And this was born in part out of a desire to create a convening space outside of COP that, one, allowed countries actually interested in transitioning away from fossil fuels to learn and strategize with each other. And two, kind of create a separate space away from the influence of fossil fuel lobbyists and greenwashing that some believe have started to shape and influence the formal UNFCCC COP process. And so this conference and its outcomes will be an interesting space to watch. Another bright spot, hot off the presses from just earlier this month, over 140 countries at the UN General Assembly overwhelmingly adopted a UN resolution sponsored by the small island nation of Vanuatu that backs a 2025 historic ruling from the International Court of Justice affirming that addressing climate change is a legal duty under international law rather than just a political choice. And so this would include reparations for damages caused by any nation that fails to take action, which is big. This passed after a concerted opposition effort from the US and other countries. And so we'll see if that creates momentum ahead of COP31 this November, based in Turkey and co-hosted with Australia. But I call it out because it's a seed of hope for nurses practicing around the world who are caring for the impacts of climate change in their communities, that the majority of the world's nations see this as their role and responsibility. And something like that can reinforce your why for doing this work. If you're feeling discouraged by the challenges we face and kind of the state of global climate action, you're not alone. And that ruling was a sign that the majority of the world is standing with you. Next slide, please. And so just this slide focuses in on nurses based in the US. The first 5 months of the year here have been a whirlwind for climate policy, and not in a fun way. The current administration has been engaged in a targeted rollback of environmental protections with direct impacts on the air our patients breathe, the water they drink, and the environmental injustice communities that we live in and care for, who already kind of bear the brunt of climate change. In February, the U.S. Environmental Protection Agency repealed its own landmark conclusion that greenhouse gas gases warm the planet and threaten health, removing the federal government's authority and responsibility to address climate change and its impacts. It's working to revoke protections not just from carbon dioxide as a greenhouse gas that gets a lot of attention, but also from methane, which is a greenhouse gas with 80 times the heat trapping potential of carbon dioxide and is responsible for about 20 to 30% of global emissions. And I don't share these trends for them to be paralyzing. I share them to shine a light on where nurses can mobilize to protect health in your workplaces and communities. For example, FEMA has suspended nearly all training and education for emergency managers who really play a critical role in helping communities anticipate, respond to, and bounce back from disasters. And so, are there ways that you can organize around climate preparedness in your community if emergency management is really your wheelhouse? The EPA is looking to rescind the environmental justice protection in its FOIA regulation that allows EJ communities to access expedited information about disparate risks to their communities from industry. And so, what ways that, could your local health system or clinic or academic institution partner with local EJ groups to study and address these risks based on their community needs? So, just kind of identifying some inroads for action for nurses. Next slide, please. With so much flux at the federal level in the US, we need nurses here to engage in climate advocacy opportunities at the state and local level to help build that healthier, more sustainable, and equitable world we want to see in our communities, while also fighting for a future that organizes the political power to get the change we want at the national and global levels as well. So refocusing efforts at the state and local level can be really impactful in this period of time. Next slide, please. So if we tap into our nursing brains, our nursing practice, what could that climate care plan look like for our communities? We're going to look over the next few slides at the role that nurses and other health professionals can play in influencing climate smart policy. Next slide, please. I really like this visual from Dr. Courtney Howard and co-authors on how we as health professionals bring about that change from the micro to the macro level. So there's lots of ways for us to shift our practice as clinicians, shift money towards renewable energy, towards more plant-forward food grown locally, towards prevention and keeping people healthy. All of these are healthy people, healthy climate interventions. Shifting towards a more equitable distribution of wealth across society, shifting power more to the people and to groups that have historically been disinvested and yet bear the brunt of climate burdens. And so these shifts can generate wins that have a tipping effect of changing the norms and policies and investments we have towards a more equitable and healthy planet. It's just about knowing where to start within our spheres of influence. Next slide, please. And so my colleagues at Healthcare Without Harm have helped with finding that starting point, with knowing where to start. Our global team just released a fantastic policy brief that highlights 5 high-impact, strategic, and evidence-based priority actions from health professionals for embedding climate and health into policies. This was a product of a knowledge to action dialogue that Healthcare Without Harm hosted with 30 participants across 21 organizations representing millions of health professionals worldwide. And the group was convened in response to the 2025 Lancet Countdown on Health and Climate Change report to distill what findings were most relevant for health professionals and then the key actionable policy entry points for health professional engagement. Next slide, please. And so before getting into the 5 recommendations, just going to briefly share the key findings from the 2025 Lancet Countdown report on health and climate change. And so those 5 are listed here. With the extreme heat impacts on health intensifying, it's essential for heat preparedness and climate-informed care to become a standard part of care delivery and our public health planning. Number 2, the health threats from fossil fuel-related air pollution and wildfires have really elevated climate mitigation as a necessary public health intervention. Phasing down fossil fuels is akin to preventing heart and asthma attacks, strokes, and premature deaths. Number three, with climate sensitive infectious diseases from mosquitoes and ticks expanding, surveillance, preparedness, and climate informed disease modeling is essential to public health. We see the broader health and economic harms of climate change mounting, disproportionately affecting low income and Black, Brown, and Indigenous populations. And the fifth finding is that, as we've already covered in this presentation, climate action is lagging behind. We need nurses mobilizing to advance climate mitigation and adaptation efforts in their workplaces and communities to protect health. So those highlights are from the Lancet Captain Report, just really important takeaways for health professionals to be aware of. Next slide, please. So those are 5 findings, and we're going to take a look at the 5 priority actions for health professionals recommended from the Knowledge to Action dialogue. And the first is health professionals should advocate with their policymakers for mandatory funded national and subnational climate health vulnerability assessments integrated into public health planning. If we don't know what the climate risks and health and social vulnerabilities are in our community, it's very hard to anticipate and mitigate those risks. Next slide. And so that's exactly what Pakistan did. From 2022 to 2024, Pakistan's Ministry of National Health Services, Regulations and Coordination oversaw a climate health vulnerability and adaptation assessment across 3 different provinces. They gathered data on priority climate sensitive diseases, vulnerable populations, and critical infrastructure gaps. And so to address the gaps they found, they, in partnership with Pathfinder International and other allies, developed some really innovative solutions, including creating and mobilizing a network of advocates they called lady health workers. Lady health workers, often the first responders to a climate event, proved central to referrals, connecting folks to resources, climate messaging, and sustaining routine care during climate events. And in parallel, trained climate champions played a role in mobilizing households, supporting disaster preparedness activities, and leading localized response networks. So this was a really compelling example of community climate resilience efforts that strengthen and prioritize women's leadership in building and nurturing climate resilient communities. And a really kind of a disseminated community-based network of advocates. And so I would ask, does your health system or community work with community health workers, and how might you partner with them to better prepare your community for climate change? Next slide. The second recommendation is health professionals should advocate to strengthen early warning systems, hospital resilience, and surge capacity planning. Next slide. We see more and more hospitals across the US are preparing for extreme weather events. On the left, this article snapshot from AAMC highlights how NYU Langone Health in New York is constructing walls around its campus to manage flooding. UW Health is working with drones to alert hospital staff to clogged storm drains. In New Orleans, Ochsner Health has a fleet of boats and tall trucks to ferry staff, patients, and supplies during storms. And so if you work in a hospital or community health center, a school, or a health department, or out in the community, what does your climate emergency preparedness plan look like, and what role could you play in strengthening them? Dr. Tara Hegel, a disaster nurse, researcher, and responder, developed a nurse-facilitated emergency preparedness intervention called NTORM, Nurses Taking on Readiness Measures. It's really cool. You should check it out. And it's been implemented from the hospital to the community, from the NICU to the senior center, to help better prepare families and households for climate threats, especially the most vulnerable. Next slide, please. For folks that are interested in this action area, I'll just put in a quick plug. My role at Healthcare Without Harm is with our Place-Based Initiatives program, a program that is convening collaborative tables of community and healthcare partners across for pilot regions across the country, looking at how the health sector can help address climate vulnerability and strengthen that community-led climate resilience and preparedness. And so if this is of interest, I included our website on the slide there. Please feel free to follow along with us on this journey. Next slide, please. And this is another resource. I'll just lift this up if you haven't seen it already as we're talking about climate resilience and preparedness. This toolkit is really an excellent resource for folks who are looking to lead in this action area. Next slide, please. Okay, number 3. The third priority action area health professionals can advocate for is to institutionalize climate health education across medical, nursing, and allied health curricula and continuing education. This is a great one with our collaborative series hosts of wonderful academic institutions. So to create a climate-ready health workforce, we need to train health professionals with these competencies. One example I wanted to lift up is integrating climate and social justice into clinical experiences for health profession students. Dade County Street Response was founded by Dr. Armin Henderson, and they're a grassroots team of health professionals delivering street medicine, disaster relief, and community care to Miami and its surrounding neighborhoods in the U.S. state of Florida. Their disaster relief program mobilizes medical students and practicing doctors to educate community members in predominantly Black and Brown neighborhoods about climate and disaster preparedness and to connect residents to resources to mitigate those risks before the next climate event. And so if you're an educator or you work for an academic institution, how might you bring climate and health education into your curriculum? Or how maybe are you doing that already? And then share that with us so that we all can learn. Next slide, please. These are just a couple other resources I'll lift up for nurse educators looking to advocate in this action area. These are resources from the Climate and Health Alliance. We can go to the next slide, Karen, if it... Oh, perfect. Yeah. These are just 2 great resources from the Planetary Health Alliance, the Planetary Health Education Framework, and they just released brand new resource, these new planetary health curriculum guidelines. So feel free to check those out. Next slide, please. The 4th priority action area for health professionals is to support clean air policies, accelerating clean energy transitions and clean transportation reform as health protected measures. Next slide. There's just a robust body of research on the health impacts of air pollution, and the reality is that 99% of the world breathes unhealthy air, so health professionals are really key but underutilized partners for the clean energy transition and its framing as a public health intervention. On the slide are 2 examples of how cities are leading the way on clean air advocacy with health co-benefits. The first is from my home base from Boston in the Northeast United States and its Community Clean Air Grant program. And this funds community-based projects that monitor, mitigate, or reduce air pollution in Boston. One current project led by a local CBO, Fairmount Indigo CDC Collaborative, and Air Partners. They're deploying residents as what they're calling backpack ambassadors. So they wear special backpacks with air quality sensors on their route to work or school to really document their exposure to air pollution along a transit corridor with the highest rates of asthma in the city. And so then this data can inform future mitigation efforts that also double as public health interventions. And then the second example, just briefly, is from the city of Paris. They have seen drastic improvements in their air pollution over the past 2 decades through a simple strategy, prioritizing people over cars. They've really redesigned their city to prioritize people's health over, through things like pedestrianizing their streets and voting for car-free zones. Another really cool example of how cities can take action through their public health and kind of urban design planning. Next slide, please. Okay. The final priority action for health professionals to advocate for is to drive whole system healthcare decarb through measurable science-based targets, sustainable operations, and regulatory alignment. Next slide. There is a lot of exciting work happening to embed decarbonization and sustainability into existing healthcare quality and safety systems, which can really be a crucial step in aligning strategic priorities and dollars. This is an example that I won't go into, but a really cool example from the Center for Sustainable Healthcare and Microtech UK on how they funded nurse-led teams to do sustainable quality improvement projects. So another cool one to check out. Next slide, please. I'm just going to wrap up here with a couple of ways to stay connected. We can go to the next slide. These are a few quick ones you could do today. Earlier in the presentation, we talked about the US EPA's repeal of the endangerment finding. Annie has launched a campaign calling on state leaders to take action and protect this established science. And so any interested nurses can submit videos to Annie in support of this campaign by May 29th of this week. Next slide. And then if you're a U.S. health professional looking to stay connected to a community that is dedicated to climate smart healthcare, please consider joining Healthcare Without Harm's Climate Smart Collective. It's really a great way to grow your network of allies and collaborators. And then next slide is my email, which is how to stay in touch with me, which I can drop in the chat too. And thanks again so much, folks, for the time. And I'll turn it over to you, Karen.
Thank you, Casey. That was really amazing. As always, you're so wonderful in your presentations. I know this is a bit of a weird picture. I couldn't find another way, but it looks like I'm floating out at the sea, but I am not, in fact, floating at sea. I look forward to kind of helping pull together what Casey said and helping you see in your own life and in your own practice how you might be able to apply some of these principles and practices. So when you think about yourself, you may not be terribly active in climate change issues. You may not have thought about it in a big way, or you may not have really made the connection between health and climate change. So when we think about our role as nurses and NPs, we want to think about how can we be involved. And I sort of broke this up into 4 categories to educate, assess, engage, and advocate. We've talked a little bit about advocacy, but we'll get into that further as we go through it. So when you think about education, we need to think about the health impact of environmental issues. So when we kind of boil it down and we're looking at the healthcare side of it, obviously pollution and contamination, disease distribution, and legislation related to environmental diseases are some ways that we need to be educated. Water pollution and contamination are a big issue. When we consider PFAS or bacteria in the water, lead, solvents, those sorts of things, we have some really current examples of where water contamination had serious and significant health impacts. For most of us, we can remember the Flint, Michigan crisis with lead and bacteria in the water that was going into the homes of children and impacting lead levels in children and their developing brains. We all know what that does to people, but this went on for a significant period of time. This wasn't a one time we had a problem with a well or we had a problem with this. This was a significant period of time. Older communities are at risk for this relative to cast iron pipes and leaching of lead solder into the water. So those things are not a one-time Flint, Michigan problem. That's a problem that we need to really consider and think about when we're working in our communities. Camp Lejeune also had a serious water-based issue when industrial solvents and benzene were found in the water treatment supplies for people who lived or worked on the Camp Lejeune base. It was leading to things like significant cancers, significant medical harm, issues with reproduction. Hinckley, California, which became famous with the movie Erin Brockovich, was a hexavalent chromium contamination caused by leaching of a pool of contaminated water into the groundwater supply, leading to significant disease distribution. And Wilbur, Massachusetts, back in the 1970s, had an industrial solvent problem. There was, of course, back in the 60s, the issue of the actual body of water being on fire in the Northeast because of so many solvents. So you need to, as a nurse or nurse practitioner, know how you can find out where to get quality water reports. It's important as you're looking at your community and thinking about the patients and the populations you serve that you understand what are they drinking, what are they washing, and what are they coming in contact with. Back in the old days, we used to think, well, if they're on city water, it's safe. It's safer than well water. You can't necessarily be sure of that. And so that's what this is a cautionary tale. When we think about soil pollution and contamination, it certainly would have a lasting impact on our food source and the food that we consume and we eat. We think about heavy metals, organic pollutions like pesticides and herbicides. We think about PFAS contamination again in the soil. You need to know that there are soil testing services. The EPA, even though it has had some changes which have uh, diminished its ability to do some of the enforcement work that's surrounding it. And this is again a political question that kind of changes based on legislative priorities of how much it's going to be enforced and how little it's going to be enforced. There are Superfund cleanup site maps that you can still access that look at predominantly areas impacted by mining, landfills, or manufacturing that have left contaminated regions. I live in the Midwest in St. Louis, and we certainly have a number of Superfund sites that are related to World War II and radioactive materials that were buried in just regular land sites, which are now leaching into neighborhoods, lakes, and streams. So that's something to think about when you're seeing your patients and you're communicating with them about their risks or you're assessing their risks. As we look at air pollution and contamination, that's an everyday issue for all of us. There's indoor air pollution issues that are related to either the air that is being brought in based on the HVAC systems. There is also contamination of chemicals used in the manufacturing and seats and desks and microplastics and things like that. And even the water supplies that are going in there can be a part of that. But certainly transportation is a big issue with emissions, carbon monoxide, particulate matter, and soot. If you live on the West Coast at all or in any major city, but LA is kind of famous for it, having these soot warnings, basically that it's really a terrible day. But I know in my city, we also have air quality reports from the EPA, and they'll rate them as red, yellow, or green air quality days, meaning that they'll always say a little signs, if it's a yellow day, don't fill up your car, don't do these things. If you're working outside, consider not doing that. And when you think about power generation, coal plants, coal burning, smog, toxic organic compounds related to industry and manufacturing, those are all things that are going to contribute to air pollution and contamination. It's something certainly to consider when you're treating patients who have certain diseases, especially respiratory or cardiovascular disease, can be a real exacerbating issue. And so we want to keep that at top of mind, knowing that it also impacts all of us because it's all the air we breathe. The increased numbers of respiratory conditions, the increased irritation, that all is part of this. When we discuss food contamination, we have seen more and more issues of contaminated food over the last probably 7, 8 years, certainly the last few years that I can remember. We didn't used to hear quite as much about it. And suddenly we're seeing a lot more contamination. This contamination can occur during growth from fertilizers, whether it's organic fertilizers or non-organic, meaning if it's contaminated with human waste, if it's used by, sometimes they'll take runoff water from the raising of animals on a farm and pump it across. That's happened a couple times in green leafy vegetable contamination, that they were using a poor water supply to actually water the plants. Now we have contamination. We also see contamination in our food process from like flour milling, packaging institutions. I think about the Infamil, the milk production issue that we saw, the contamination of baby formula that went on for a long period of time. That's a significant issue. If you don't have good, safe, healthy food, water, then your population suffers and illness is a result. Meat processing, we certainly see E. coli contamination. We certainly see contamination based on how the meat is grown. These large scale production industries, whether it's chicken or poultry or beef or pork, we will see that these large scale farms can sometimes be problematic when we're looking at the processing piece. We need to know as nurses and nurse practitioners, how do we access state health department for reporting of potential contaminated food sources? If you have someone come in and they're showing symptoms of maybe a GI upset or some sort of a potential for a foodborne illness, you need to know what to do next. So testing, reporting, because only the CDC in conjunction with these local state authorities can do the epidemiologic work to make sure that we're tracking down food sources. There's always a patient zero, if you will, the first person to get ill with a foodborne illness, but they are not the last. So being vigilant about that and really paying attention to that can help us identify those issues and risks. When we think about disease distribution, that's a significant part of this whole scenario as a nurse, an epidemiologist, a public health nurse, is really identifying where you're seeing these clusters. Again, I go back to Erin Brockovich. It was a fun movie, but it was also really a serious movie because it took someone connecting the dots. It took someone saying, we have a whole community that's being impacted by leukemias. We have a whole community that's being impacted by increased rates of miscarriage. That's the work of public health and epidemiologists, right? But as people on the front line of healthcare, that's our job too. If we suddenly work in a community and we start seeing patterns that seem alarming to us, that's when we need to sound the alarm and get the right agencies involved to say, let's investigate this. Raise this to your state health department. Raise this to the CDC to have them investigated. You often will also see increased respiratory illness, cardiovascular disease, infectious diseases, and vector-borne diseases. And when we're thinking about this, the cancer clusters, I just used the Camp Lejeune and the Hinckley issues to kind of illustrate that. Camp Lejeune, the VA, the Veterans Administration, has now recognized the following conditions as being a direct result of the contamination that happened in the 50s through the 90s in Camp Lejeune. Leukemias, anemias, bladder cancers, kidney cancers, liver cancers. So when you think about it, it's the body, all the things that it hits, all the cell lines that it hits on its way into or out of the body. Non-Hodgkin's lymphoma, and even Parkinson's disease. The Hinckley cluster, we saw lots of cancer clusters and reproductive issues in the hexavalent chromium. So all those things were identified by someone who said, hey, we've got a problem here. And then they started looking back and realized how much of a problem it was. When we think about respiratory and cardiovascular disease, certainly air pollution, air quality, respiratory irritants would be an issue to consider. When you're looking at patients and they're coming in to see you, and maybe they have asthma that's not well controlled, or it's a new onset of a respiratory condition, think about what are nearby industries. Does the patient live in an area that's very industrialized? Are they in a city that has lots of chemicals being put into the environment? Are they living downstream? When I think about contamination from this nuclear dump here in the Midwest, we had it's called Coldwater Creek, would flood every year and contaminate the neighborhoods nearby, including a preschool, Jana Elementary, which has been flooded several times. And then they would just clean them up, have somebody come in and say, oh, it's fine, and send children back in. So that has now become a major RECA issue that they're working on radioactive compensation for that. But these are all things that you need to think about. And largely it was healthcare workers, community healthcare workers that started saying, we're seeing sick kids. We're seeing things that don't make sense from these neighborhoods. Something's going on. It's not just another outbreak of some little illness. We are really seeing patterns. And those patterns is what gives us the insight to look at it. But as nurses and as nurse practitioners, it's recognizing that these are real risks in order to connect those dots, right? So we may have a pattern, but if we're not thinking, oh yeah, they live in an industrialized area. Oh yeah, they had flooding, which occurs commonly, and there is a waste dump that is leaching. All of those things we put together to help our healthcare providers come to the epidemiologic conclusions that they are. When I think about infectious disease and vector-borne disease, which are closely tied together, infectious disease we already talked about with the foodborne piece, but the spread of infectious disease caused by vectors is directly related to change in patterns of where we find the particular vectors. how the warming of climate has caused vectors that used to only be, say, in the southwest US to kind of migrate up. We're now seeing it higher. Lyme disease is not only in Connecticut, it's migrated across the Midwest and down a little bit because as our climate patterns have changed, we're seeing introduction of other vectors that are not dying over winter. For example, tick season has been particularly aggressive here in the Midwest. And we're looking at Rocky Mountain spotted fever, which has typically been highest in like Missouri and Oklahoma and Kansas, is now spreading further because those ticks are not dying, so they have a better spread. Alpha-Gal syndrome has become another tick-borne issue of note. And when we think about mosquito-borne diseases, we saw malaria occurring in the southwestern United States, southeastern United States and Florida, organically found. In other words, it wasn't transmitted in by someone who traveled to a malaria zone and brought it in. It was actually locally transmitted. So that's another issue we're going to have to consider. The mosquitoes that spread chikungunya and dengue are now in the US, as well as malarial mosquitoes, which we had kept them kind of at bay since yellow fever outbreaks way back in the day. We had not had those particular vectors here, but now they're all creeping up because we're warming. So that's an issue to consider. And when we think about legislative ways that we can be aware and engaged, the Clean Water Act, which is part of the EPA, started back in the 70s. It has been modified and changed. It changes pretty much every year based on how people want to modify it, change it politically, the political will to adhere to clean water summaries. And pretty much every year they come back and say, well, this is what we're going to enforce this time, or this is what we're going to enforce this time. My point is that legislation is always changing. And so you have to be on top of it. You can't just say, well, okay, the Clean Water Act guarantees clean water. Well, yes and no, because the number of organic compounds that can be found in water and still considered safe, that is always updated based on the political will to get polluters is basically where that comes from. OSHA is something else, the Occupational Safety and Health Administration. Many workers are exposed to hazards, environmental hazards on the job, and may feel less able to advocate for themselves because they need to work. So if you're working as an occupational health nurse or in an occupational setting, be aware of what chemicals they're exposed to, what particular hazards may be around them, how much are they getting, what is the water like even in the plant or the building. I had a company where the water system within the plant actually became contaminated, so then that was an issue for all workers. Looking again at RECA, the Radiation Exposure and Compensation Act, it was updated in 2026. So that is something to be aware of for your communities to find out if your communities can receive compensation under RECA. Make sure that you're aware of that so you can better advise your patients. And the Food Safety Modernization Act, that is something that is also changing food safety standards and something we need to keep our eye on. Food safety, again, food, water safety, air safety, those are all things that all of us need and all of us count on. And while, to Casey's point, a lot of ways we can interact will be on the local and the state level if we're not able to get federal legislation, which all this needs to be at a federal level. But if that's not possible, then looking at how you can be able to advocate in your region is important. And when I talk about education, you need to educate yourself. You need to educate yourself on reporting of suspected cases, basic reports where you can find them, community surveys, disease distribution clusters, really know where the data is because a lot of this data sits out there. But if someone's not connecting the dots or if you're not connecting the dots, get to know your community well. If you're working in a particular area that's served by 2 or 3 zip codes, make sure you understand those zip codes. Make sure you understand what kind of production's going on there, where people get their food from, how much do they have to walk or ride transportation, what kind of public transportation is available. People tend to stay in their little communities. So even if you're in an urban area, most of the time people won't transit from way over one side to way over another. They stay in like a 3 or 4 zip code region. So really understand those zip codes, do the work, dig in and do the work. For your patients, you want to make sure that you're educating them about avoiding risks. and air quality and respiratory disease, cardiovascular disease. If you have a patient who has those conditions, make sure they understand how to interpret the red, yellow, green days. Make sure they understand what things are placing them at risk. Um, Understand what resources there are for areas they're concerned about. And food safety. It's always good to go over basic food safety with patients. We assume that patients understand how to safely handle and process food, but that may not be the case. So making sure you're educating them about that and where they actually receive their food. Know that sometimes their choices are limited by if they're receiving governmental assistance for food or if they're relying on food banks and that kind of thing, they could have less choices. But teaching them how to be good readers of packaging or how to pick the best choices for their family, the freshest choices, those are all going to be things that would be helpful to educate your patients about. When we go in to assess, I think about how are you going to assess the patient? You want to make sure when you're doing your H&P, you're doing your history and physical, that you consider environmental causes for their signs and symptoms, that you include environmental questions in their health history. Think about household and neighborhood environmental context. Consider those community surveys we talked about. Are they getting their water through well or public water? What kind of sewage? Do they have septic systems or do they have public sewer? Think about how old their house is. Do they have leaching, lead, contamination, lead paint? What kind of industries or waste facilities may be nearby? Those are all going to be important to know. And when you think about engage community partners, engage local media. Make sure you're ready to give an interview and talk about how these have real health impacts, how a particular issue is important to patients and families. Make sure you get involved with your nursing and nurse practitioner organizations. Educate them. You can be a source of education for those. Volunteer to give a speech on it. Volunteer to give a talk on what kind of legislation's coming up. And interact with local government agencies for inspections, reporting. Engage lawmakers at local, state, and federal levels, and certainly engage your patients. When we think about advocacy, it's going to be important that you actually know how to advocate. You might want to consider formal media training. AANP offers a media toolkit for NP members. George Washington University has a Center for Health Policy and Media Engagement that is very relevant. And the International Council of Nurses Global Nursing Leadership Institute is another organization that teaches you how to advocate and how to be media savvy. And be aware that social media is media. So the messaging you're putting out there on social media is going to be important. When you think about meeting with legislators, you want to really develop a relationship with them, with their staff, and with the legislators. Attend town halls, always be respectful, but state your case clearly. Attend advocacy days that nursing organizations, NPs, and climate health organizations will have. Show up. I mean, that's basically the big thing. Show up. Make your voice heard. Be succinct, be clear, but be passionate. And when we think about achieving the SDGs, the Sustainable Development Goals by the UN, and you look at all of them that are related to the issues that we've raised today, clean water and sanitation, affordable energy, decent work and economic growth, all of these things, as well as climate action, life below the water, life on land, there are a number of issues that are touched by this. And I would say further, all of them are really touched by this. So this is an underlying piece of the Sustainable Development Goals that get us to a healthier planet and a healthier people globally. Some organizations for engagement we have listed here just for your reference. Here are some references that we used and a few resources. And contact information for Casey and for me. We say thank you very much, and we are open to your questions.
Hi, everyone. I know we're at the top of the hour. That was such an amazing presentation, just a wealth of information and immediate takeaways, too. If for anyone that can stay on just a couple more minutes, please offer your questions either in the chat or just speak up, and then we'll stop the recording. Yeah.